Hello, and welcome to week 6 of PUBH 612. Today we will review program objectives and how to set targets. The learning objectives for this week are to be able to write clear, measurable process and effect objectives, to distinguish between process and effect objectives, and to develop realistic and achievable target values for your objectives. Goals and objectives enable us to judge if a program has been successful and are commonly used terms in program planning and evaluation. Goals are always statements about the health impact or status of the intended audience, and they generally have a longer time horizon. Goals are also broad and encompassing statements, and there are generally one per program. Goals don't typically have quantifiable terms, while objectives do. Objectives are specific statements about the work to be done or the immediate effect on the program participants. Objectives have a shorter time frame and are measurable. Objectives focus specifically on the process theory or the effect and are either called process or effect objectives. An easy way to remember the parts of a good objective is the statement, by when, who will achieve what, and by how much. For direct service programs, the time frame for objectives typically are 1 or 2 years, while timelines for population services programs are longer, such as 5 to 10-year time horizons. You can see this in the 10-year Healthy People targets. Here you can see a graphic depiction of how elements of the program theory can be used to develop program objectives. Process objectives capture the essentials of the process theory that describe how the program is delivered, focusing on the activities of the program staff or the participant. The process objectives should have the following elements: T for time frame, A for amount of activities done by which participants or program staff, with the acronym TAAPS. For example, a process objective might be, by month 6, 100% of program staff will have participated in 90% of the training sessions on how to use health education modules being used in the program. Effect objectives focus on the benefit that program participants will experience as a result of participating in the program, and they will follow the formula of including what time frame, what proportion of recipients experience what extent of which type of change, with the acronym TREW. So in other words, how much intervention, how many recipients will experience what extent of which type of change. In this table, you can see how the organizational plan, service utilization plan, and process theory outputs become process objectives. So for example, the process outputs are not about seeing an impact in the participant, but they are about measuring if the staff, in this example, distributed 100 brochures to women at the clinic by a certain date. Here is a section of Table 6.2 from your text, which describes examples of different variables which are used to measure different health outcomes. So for instance, you can see that for physical health outcomes, there are classic indicators of weight, cardiovascular fitness, medical diagnosis of acute or chronic illnesses, and these are often used to measure the program effect on that domain. So if you have a physical health program, that you're typically going to be measuring these types of variables to see if your program's been successful or not. When selecting indicators and variables for a program, there are several criteria for you to consider. First, you should consider if any indicators are required or mandated by the funding agency. For example, HRSA requires that all grantees of certain maternal and child health funds report on the rate at which children are hospitalized with asthma, or report on the percentage of low birth weight babies, for example. Another criteria is if data collection is going to be feasible. Obviously, you want to make sure that you're going to be able to collect the data and then therefore report on it. You also want to make sure the variables that you've selected are scientifically defendable. And in order to make sure that the variables are scientifically defendable, you should be using standardized or existing questionnaires or tools which have already been validated. And then lastly, the measures should also be easy to analyze, because if it's too difficult to analyze the data that you've collected, you could wind up collecting lots of data and then never translating that data into action. Table 6-4 provides examples of intervention, outcome, and impact objectives for the goal of reducing birth defects. So you can see in the middle column, the theory of the intervention would be that after taking prenatal vitamins the year before pregnancy, 100% of women in the program will have normal blood levels of iron and folic acid. You've probably heard the term SMART objectives in program planning or evaluation, and SMART stands for specific, measurable, achievable, realistic, and in a timely fashion. Can you get this done in a reasonable amount of time? These can be very helpful to reflect on as you develop your objectives, to make sure that your objectives are good and appropriate. Both the number of data sources and the consistency of data across these settings influence the target setting process. Targets help determine if the program was successful, and if a program has achieved a target, or if you're moving towards a target. Here in Table 6-7, you can see a framework for target setting and the interaction between the data source available and the consistency of the information. So if you have many data sources and they're all saying the same thing, then arriving at a target should be pretty simple, because it will reflect consistent values and similar target values will be reached regardless of which data sources are being used. But if you have inconsistent information across sources, the decision about data sources becomes more difficult, and you'll need to consider the strengths and weaknesses of each data source, including sample size, data completeness, and other quality aspects, such as if the measure has been validated. There are many options for calculating a target value, 3 of which can be seen here in Table 6-8 from your text. Option 1 assumes that no change in the health problem will occur because of the health program. This could be used as a default and may be appropriate for programs which are mature and they've already achieved their goal and they want to just maintain that current value because it's already acceptable and healthy. The advantage of this option is that it doesn't require historical data, but the disadvantage is that it doesn't require any improvement. Another option is to select a desired percentage change, as seen in option 3. So you select a desired percentage change in the health problem and then convert that percentage into a definitive target. For example, if adolescent health data have shown that there's an annual 2% decrease in teen births, we can use this as a basis for a new program target of 4%, a 4% decrease in teen births annually. And we can use that percentage to calculate the new rate per 1,000 female teens that we would expect to see in a year. This is a straightforward option. It's easy to understand, but in order to use option 3, we must know the trend to develop the target. Please see pages 165 and 166 in your textbook for the complete table with all 10 examples of different ways to set targets. While goals and objectives may seem straightforward, these three things need to be considered when you're setting goals and objectives. First, there's been relatively little research on if setting objectives motivates staff to work toward them. And using objectives as the basis for decision making should be complemented and supplemented with attention to gaining staff acceptance and using resources to support staff in achieving objectives, or perhaps using a reward system that makes achieving the objectives meaningful. Second, the goals and objectives need to be adaptable and flexible because complexity theory suggests that work group settings that are more flexible and spontaneous are more productive. This might not be possible if you're a federally funded program with strict requirements, but in some situations, managers may find that less structure and less reliance on objectives will lead to a better program. And third, sometimes objectives are created, but then are forgotten and they're disconnected from program oversight. Typically in healthcare outcome objectives, they're linked to performance measures, which are used for quality improvement. And we will discuss this in greater detail later in the semester. The key takeaways for this week are to make sure that you understand the difference between goals and objectives and how to craft them. Also remember that setting SMART objectives is a crucial part of program planning and evaluation. And there are criteria you can use to help you select the most appropriate indicators for your program. And make sure you're meeting any funding requirements, that the information that you're collecting is feasible and scientifically defendable and easy to analyze. Lastly, there are many ways to set targets for your program, and as targets will help to determine the successfulness of your program, it's important that you spend time considering which of the many target setting options works best for your program. Lastly, here are some internet resources which you can check out. Please see Blackboard for any additional materials for this week.